I'm very excited to tell the optometric community about our film that's coming out. It's called Open Your Eyes 2020. It's a documentary about the optometrist. For years, the optometrist has been pigeonholed as a doctor who just does contact lenses and glasses. As everybody on this program knows, we do much more. The documentary is going to explain the relationship between systemic disease and the eye. In fact, there's over 170 systemic diseases that affect the eye, and there are many medications that have their side effects that manifest in the eye. Now, if the optometry community doesn't explain what optometry is, the online refractionists are going to explain who we are. So it's very important that we're the ones that explain what our profession does. The film will be somewhere around 90 minutes long. It'll be able to be broken up into 1 minute, 3 minute, and 5 minute segments, so you could have it in your office and you could display it and explain about our profession. You could pick the best parts that you like. We've raised over $600,000 for this film. I've been to over 16 places. I've been to Europe, and I've been to Nicoya, which is one of the blue zones. The blue zones is where people live over 100, but they don't get the diseases of the West. And that's me up in the right in Nicoya in Costa Rica. Down in the right, that picture is in Nassau. That's David Helmers. He was an astronaut. Up to the left is Dorothy Hitchmont. That's in New Hampshire. And down to the left, I'm speaking with Jason Fung, who's a kidney specialist in Toronto, who's written a number of books on obesity and diabetes. So I play the role as the interviewer, going to different places, speaking to experts on the future of eye care and the future of health care. So we're very excited to have this film, to give it to the optometric community for their patients. You're going to get the film. The producers of the film are going to do all the distribution, and all the optometrists in our community will get the film. They'll be able to use it. They'll be able to use it for marketing. Now, the film is agnostic. It doesn't promote any specific brand, any specific type of lens or contact lens. The only thing it promotes is the optometrist, and that the great work that optometry does, and that we're going to explain to the public what we do besides glasses and contacts. So look for the film. We're very excited it's coming out. It's going to be used to help our profession. Please go to our temporary website, Open Your Eyes 2020, where you could see our very exciting 5-minute trailer, and you could also see photographs of different places that I visited. I'm very excited for the film to come out and for the optometric community to get behind it and share it with their patients and their friends, so people understand the great work that the optometrist does. Now back to diabetes. So the eye, as we know as eye doctors, is a tremendous biomarker for diabetes and other systemic disease. There's over 170 systemic disease that can manifest in the eye, as well as different medications. So as eye doctors, as the technology is getting better and we could see smaller and smaller blood vessels, when we first had fundus photography, we were looking at blood vessels at 100 microns, maybe 200 microns. Now we could see blood vessels with OCT at 8 microns that were multispectral imaging with 12 microns. So we're in a position where we're going to be able to see different changes in the eye that would be indicative of changes in the body. Diabetes, as everybody knows, is really increasing and is a national health issue. There's over 30 million people as of now with diabetes, and which is about almost 10% of the population. There's about 18 million people who are undiagnosed, and about 84 million people who are pre-diabetic. That means that between the diabetics and the pre-diabetics and people over the age of 20, about 50% of the patients are either diabetic or pre-diabetic that are going to come into your office. As optometrists, we are now in the position where we're specialists in vascular disease because nobody can see the small blood vessels like we can. So this will get us to work with other subspecialties, other subspecialists like cardiologists. Dr. Gold?
So you may be wondering why a cardiologist is talking to you about diabetes. And as it turns out, diabetes is one of the traditional risk factors for cardiovascular disease that we look at. As a matter of fact, having diabetes poses the same cardiovascular risk as if you were to have a prior cardiac event, such as a heart attack.
So diabetes and obesity mirror each other. As obesity is going up, we're seeing more diabetics. Now, Jeff, in your practice as a cardiologist, and somebody comes in with that big belly, what does that mean to you?
So when I see that in clinical practice, Kerry, it's really indicative of diabetes. One of the clinical signs that we see. It's an early marker for metabolic disease.
So here is a study that was just released the other day, and it looked at the average weight of the American man and the average weight of the American female. The average weight of the American man is up. It's 197 pounds, almost 198 pounds. And the average female is 170 pounds, a little bit more than that. And the waist circumference is bigger. So what that's telling us is that people are getting metabolically worse. There's becoming more metabolic syndrome, and people are becoming more at risk for diabetes. We know the incidence of diabetes is getting worse, and as optometrists, we're on the front line. Many times, as you know, the optometrist is the first one to diagnose diabetes, whether we'll see a microaneurysm or we'll see little dot hemorrhages. How does that work in cardiology? When you see these, again, with these big people coming in, what are some of the tests that you may run, and what do you think is more important, weight or or waist circumference?
I mean, waist circumference is an incredibly useful tool in diagnosing these patients with obesity. It's a sign of underlying metabolic disease, and as we've already alluded to, these patients have increased cardiovascular risk.
There was a recent study released from JAMA, which was over 25 years, that showed that 25% of the obese population is increasing in their incidence of type 2 diabetes. But this is also true for people that are thin and not fat. There's a 25% increase in type 2 diabetes in the normal weight population. So we want to figure out why that's happening. If you look at this Venn diagram here, on the left side, you see 72 million people. This is the obese with BMI over 30%. The normal weight population is on the right with BMI under 30. So the obese is 30%. The normal weight population is 70%. Now, if you look at the left side, if you're obese and sick, of the 72 million people that are obese, 80% are sick and metabolically sick. If you look at the normal weight people, 40% of the normal weight people are sick. So it's 57 million people who are metabolically sick. That means they have diabetes or any one of the metabolic hypertension related to being metabolically ill that we spoke about or we're going to speak about. And on the right side, we have 67 million. So if you put them both together, we have about half of the adult population that are metabolically sick. So if this was only from being obese, that would be able to answer the question, lose weight and you're going to get better. But what about the 20% of people that are obese that aren't sick? That's called MHO, metabolically healthy obese. MHO, metabolically healthy obese. Why are those people not getting sick? And if you look clearly on the right side, it's half the amount, but 40% of those people, or 67 million people, are getting metabolically sick. Why are they getting sick And so there's been a lot of research in this to try to find out why this is happening. So, the standard mantra is you should diet and exercise. That's what the American Heart Association, the American Diabetes Association, that's what your doctor will tell you. But it's a lot more than just that. So, what this means is that type 2 diabetes isn't just about behaviors or bad behaviors. What it's also about is exposure. And diabetes type 2 is multifactorial. And we're going to talk about the causes as we go through the presentation. This slide further explains what I was speaking about is the concept of TOFI, which is thin on the outside and fat on the inside. This term was coined by Jimmy Bell at the College of London, and these people all have the same waist circumference, but you could see the visceral fat, the fat within the organs on the top slide. You don't see much fat at all, but on the bottom right slide, you could see how the visceral fat is 4.3 versus 0.5. The more visceral fat you have, the sicker you are, because visceral fat becomes an organ within itself, releasing inflammatory mediators causing inflammation. If you have subcutaneous fat but no visceral fat, then you're metabolically healthy. If it's the visceral fat that causes the metabolic problems, releases the inflammation. As we know, inflammation is the core component of chronic disease. We will revisit obesity later on in the presentation. Dr. Lisa Renzi is a vision scientist at the University of Georgia, and she gave a very inspiring lecture, which she said the OD is the new GP. And what she was talking about, as we alluded to at the beginning, that the eyes are a biomarker of aging and a biomarker of systemic disease, whether it's a side effect from systemic medication or one of over 170 systemic diseases that could manifest in the eye. So I think that people outside our profession are starting to see how important the eye is. It's about time that we, as optometrists, take that very, very seriously. So this slide depicts the fact that diabetes is a multifactorial disease. So the concept of treating diabetes like we treat an infection, one pill for diabetes, doesn't work because diabetes is very complex. There are many factors involved in the cause of diabetes. Diabetes, if you look at any site of diabetes, even depending on what country, you always see that diabetes is a chronic progressive disease when you're using medication. So the patient always kind of catches up to their medication and their diabetes continues to get worse. So if you don't look at the lifestyle and some of the underlying causes, the patient will get worse. That's what we're going to talk a lot about today on some of the causes and what you could do to help even maybe reverse diabetes. And patients actually get frustrated with the way they're being treated with diabetes. That's why over the past 10 years, more people are looking toward alternative healthcare practitioners than allopathic MDs and DOs. Patients come into our office, they're on multiple medication. As you can see from the slide, 60% of Americans are on at least one prescription medication. 15% are on more than five or five. Sometimes patient comes in, it's on 7, 10. I've had patients on 15 different medications. As a cardiologist, how do you reconcile that?
So this is a difficult problem. I'm seeing the same patients in my office that you're seeing in your office, and they're on a long list of medications. And in this age of subspecialists, um, everybody's trying to do the right thing in their particular area. So the patients are getting prescribed different medications from different doctors. What I try to do is take the opportunity to review their medications, discuss it with their general practitioner to see if we could streamline their list of medications and to discuss the importance of lifestyle modification along with this.
Because typically people just don't have diabetes. They'll have hypertension, they'll have elevated cholesterol. So they all kind of go together.
Correct. It's a metabolic disease. These are chronic diseases, so there's a lot of overlap amongst these various diseases.